How to set up and grow a successful independent practice. When we started talking about this with Rafid, I mean, he said, just stand up and tell your story, because from my perspective, this should be how not to set up and grow a successful practice, because I made a total cock of it the first time I tried. Let's go back to my story. It all kind of started with an injury, actually, in 1986. That is actually me as well. No, difficult to believe now, but I did look like that once. Oh, bless you, bless you. Had a back injury, ended up going to see an osteopath. It kind of put me back together every time I got injured, which was a lot. I agree with Rafid, probably not such a good idea to play rugby. So off I went to study at the British School of Osteopathy for 4 years. 1990, qualified, set up a clinic straight out of college, as you did. And then things went very wrong. I rented a premises, put up a glass plate, put a one-line advert in the Argus, and because I thought I was good at marketing, I actually took out an ad in the Yellow Pages. Yes, this was the time before the internet. I'm that old, I'm afraid. So what did you do? You sat back and waited for that stream of patients just to come and see you because I had an advert in the Yellow Pages. But needless to say, it didn't happen. It ended up me having to close the clinic in 6 months with about £15,000 of debt, which 30 years ago seemed a lot of money. It seems quite a lot of money now, actually, but then it was even more. So I had to do something. So I started giving talks, and I actually met a dentist who had some spare space. So I ended up starting my own clinic using a portable osteopathy table in the dentist's room, and which was, I don't know if dentist rooms don't tend to be that big anyway, and there was a dentist chair in there. I had to move the dentist chair out the way to put this portable clinic in, table in rather, so I'm pretty surprised I haven't got a real back issue by doing that all the time. And I just started seeing patients there. I also managed to get a job in a local osteopath as an associate, which kind of helped pay the bills and pay back the loan. And then I ended up getting an NHS contract running a back pain service in a large local GP practice. I was fortunate because I learned very early on that building trust in your patients and doing your very best for them was essential. And I began to build a practice really by word of mouth only, with the belief that if you looked after your patients, they'd look after you. And the good thing is they did. Because what happened is, over the years, we grew, we expanded into 2 full rooms. We discovered the importance of why we were there and what our purpose was. And that was really looking at our patient profile and knowing that the majority of them are suffering with spinal conditions and back conditions. So we found our focus, and we kind of went slightly against the trend, which very often in osteopathy is like kind of, we don't just treat backs. We kind of went against that, and we kind of said, we just want to treat backs. And we had big plans to expand the services from then. So we kind of moved forward in 1997. We moved to self-contained premises, 58 Newton Road in Hove, which is still our home today. This move allowed us to bring on more staff. Now, anybody, I think, that doesn't work in a single practice and has other staff members in it knows that that very often poses a few problems. And I kind of learnt the hard way with that. We had some pretty disastrous relationships with associates and other practitioners. But you kind of learn on your feet, and hopefully I can give you the benefit of some of that experience in just a minute. Again, we continue to expand over that time, always putting patients first. I think the good thing is this patient-centered thing seems to be a kind of universal thing that's come across from everybody today, which I think is excellent advice. So we grew from 2 to 6 treatment rooms. 2010, we diversified a little bit. We started to implement IDD therapy within the clinic, which allowed us to offer non-invasive alternative surgery or spine injections. More about that later. well, just next, I think. And this is where we are today. We've got a really strong team, which we're very proud of. They're friendly, approachable. Everyone shares our purpose and values, and completely focused on patients and the very best treatment that they can give. So what are the lessons I've learned? So really the first is purpose. Always be clear on what you do and who you do it to. Don't try and be all things to all people, and know who your who are. You can't possibly, I think as Ben said, spread yourself too thin. And what makes you stand out from the practitioner down the road? I think the second thing is having a clear vision. What do you want your practice to look like, feel like, and what do you want to achieve? You want a single practice, or do you want a large multi-centered group, or like Ben sounds like, do you want to take over the world? And use the vision to guide you in your day-to-day activities so you can achieve this. Culture and values. I think this is the main thing I've learnt when you start taking on staff and build a bigger clinic. They need to be aligned to this. You need to be very clear of what your practice culture is and communicate that really accurately to your team in order to get them on board. I think if not, it's a bit like herding cats, which I've never tried, but I've heard it's not that easy. With your team, train them well, spend time on this. It's an investment. You look after them and support them. They're representing your practice and they can make or break it. Prioritise patients. Build trust. The interesting thing is, someone told me recently, trustworthiness is not the same as trust. Trustworthiness is implied trust you have to build. So look after them, and as they did with me, they'll look after you. And then service, and I think, again, Ben and Elliot both alluded to this. I believe healthcare is the ultimate customer service industry. You know, we're privileged to be in charge of our patients' most cherished possession, their health. And I think we need to respect that and make sure that we're always giving them the best level of service we can. So key factors in setting up and growing a successful independent practice, once you've got it wrong, for me would be know where you want to go and stay true to this. Put your patients at the centre of everything you do. Look after your people. And although you do a serious job, don't take yourself too seriously. Thank you.